Good morning. My name is Abby. I'm the Community Programs Coordinator at the North Dakota Department of Health. You probably all know me. I want pleasure to introduce you to our, what is this now, third installment of our TFND webinar series. So thank you all for coming, joining us on this chilly morning. I will turn it over to Heather to introduce herself, which she doesn't need to, but to start, TFND is presenting their policy strategy over the next year in preparation for the 2022 legislative session. Just a quick reminder, this is being recorded, and so it will be available for those who aren't able to attend today, or if you need to share it with someone, that will be available. And our next series is scheduled for February 17th, and we'll be sending out information on that shortly. So, Heather Austin.
Thanks, Abby. Thanks for helping us host this morning, and thank you to our friends at the Department of Health for being our partner in this educational series. And thank you to all of you for showing up this morning and giving us some of your precious time. I know that's a hot commodity these days. For this morning, a few goals I have are, as Abby mentioned, to go over TFND's policy priorities, but also to give a little bit of background on tobacco policies in general, as well as to talk through a little bit about the legislative process that we follow when session is occurring and how you can participate alongside us. And so I'll walk through some of the procedures, I guess, if you will, and how we can best utilize some of the virtual options that they put in place this last legislative session. I think we're really fortunate here in North Dakota to have access the way that we do. We've always had amazing in-person access at our Capitol here in Bismarck, but all of the virtual options that they added for the 2021 session, mostly due to the pandemic, is really kind of the silver lining, in my opinion, because it allowed people to participate that probably would have struggled to participate in the past. You no longer have to drive 1, 2, 3 hours to get to the Capitol to give testimony. You can do it online, you can do it in person, and participate virtually easier and more effectively than we've ever been able to before. So we'll spend a chunk of this morning walking through kind of in real time how to best utilize the nd.gov website, so you have a little bit of a better understanding on how to use it come fall and next winter, next January, when we're in the thick of things. So for some of you this morning, this might be a little bit old hat. You're going to see some review materials. I'm hoping to tie together some information that you would have already received in the first 2 installments of this series. If you recall, the first session was about how to talk to youth, and we went through the youth presentation that is available for you to use, however you see fit. And then Andrew spent a great couple of hours for the second session talking about media resources and how to best interact with media. And so you're going to see a couple of chunks from each of those presentations appear in this morning's presentation, because it does all kind of tie together when we talk about policy and advocacy and, on my part, lobbying. And so with that, I am going to go ahead and bring up a PowerPoint that combines some of that. And then toward the end, we'll get into scooting around that website like I talked about. All that being said, as a very long preamble, I am pretty informal when I present. If you have questions as we go throughout, feel free to ask them right away. You don't have to hold them till the end, although I will leave some time at the end for us to do a Q&A session. But if it's relevant and timely, feel free to ask it while we're chatting, and we can have a little bit of dialogue throughout the presentation. So it's not just me talking at you guys for an hour and a half to 2 hours. So I am going to share screen here in a moment. See if I can get this going. And we'll get this PowerPoint pulled up. Abby, can we see the PowerPoint on the screen?
Yes, I can see it.
Excellent. Okay, so this I cheekily named Stuck in the 90s for a conference I did last spring, right as session was wrapping up, basically because a lot of our tobacco prevention policy hasn't changed much since the 90s, unfortunately. For those of you unfamiliar with me, as Abby said, my name is Heather Austin. I am the executive director for a nonprofit called Tobacco Free North Dakota. We are considered the statewide coalition or the statewide nonprofit that works primarily on policy advocacy for tobacco prevention mainly, but also a little bit of cessation. And we do a lot of education across the state. We attempt to build coalitions and help support any local coalitions that you might have in your communities. And then we perform the function of lobbying, which I'll talk about how that differs from advocacy in just a minute or two. But I do have a 7-member board of directors. They are located all across the state. We are a standalone nonprofit. We're not part of an agency or any other organization. So for those of you that are new to Tobacco Free North Dakota, and if you have questions on who we are and what we do, we can talk a little bit more about that separately. Just feel free to shoot me an email or give me a call. Our mission is to improve and protect the public health of all North Dakotans by reducing the serious health and economic consequences of tobacco use. This does remain our state's #1 cause of preventable disease and death, and we'll go over a few statistics here, just so that you are familiar with what we are working with. Current tobacco statistics for North Dakota are that around 1,000 North Dakotans die every year from tobacco-related diseases. Around 8.3% of our youth in North Dakota smoke. That compares to around 18 to 19% of adults that are considered daily addicted smokers. The concerning statistic over the last couple of years, the last several years, has been the vaping or electronic nicotine delivery system, ENDS products use rates. That stands at around 33% in the 2019 YRBS numbers. That's Youth Behavior Risk Survey numbers. We are waiting on some new 2021 data to come out, hopefully in the next couple of months here of 2022. It's always a little bit of a lag behind to get those updated survey results. So we'll see just how much the pandemic has possibly affected those youth rates, for good or for bad. And annually, North Dakota spends $326 million on health-related expenses directly caused by tobacco use. This does not take into account the lost productivity, which we estimate at around an additional $239 million every year. And it also doesn't take into account the electronic product use consequences. That data isn't collected the same way that smoking data is, because in North Dakota, electronic products aren't classified as tobacco products. And so they're not monitored and tracked or regulated in the same way. And so we really don't know the economic consequences of the upward trend in vaping for North Dakotans. And so we advocate for policy in large part because of the harm that these products cause, the disruption that they can cause to not just the household, but to society at large. And there's really no consumer product on the market that mimics the inevitable, causes of disease, disability, and death, and the enormous costs of those things the way tobacco does. And this is when you use the product exactly as it's intended, which kind of boggles my mind a little bit. So what works best to prevent tobacco use, and what policies do we follow? For the most part, we concentrate on the 3-legged stool of tobacco prevention policy as recommended by the Center for Disease Control, the CDC. These are evidence-based best practice policies that we pursue, and North Dakota has one of what we consider 3 legs of the stool for tobacco prevention use. So we have a very, very strong indoor smoke-free air law. In fact, North Dakota has one of the best indoor smoke-free air laws in the nation. Our language includes everything that can be not just smoked, but combusted, aerosolized, vaporized. All substances fall under that purview. So it's not just tobacco. It would have included marijuana, for instance. If the recreational ballot measure had passed, you still would not have been able to smoke or combust marijuana or vaporize marijuana liquids indoors, had that passed. It didn't pass, so it's kind of a moot point at this point. But all that said is our smoke-free air law is very, very strong. It's the one check mark that we have, and it's been under attack the last 2 legislative sessions. And so one of our priorities for the 2023 session will be to push forward another very strong educational campaign and advocacy campaign on preserving our indoor smoke-free air law and not allowing for any rollbacks or exemptions or exceptions to be written into that law. The last 2 times a carve out for cigar bars has been attempted, and both times it's been kind of a close call. This last time in particular, we'll talk more about in a few minutes, but it only failed by 1 vote. And so we anticipate seeing that come back to the forefront again, because I'll tell you something, if I lost a vote by just 1, or I had a bill that I was pushing hard fail by only 1, I certainly wouldn't give up. I would continue to try. The second leg of the stool is comprehensive tobacco prevention program funding, tobacco prevention and cessation program funding in particular. And this is housed through our North Dakota Department of Health and represents the coordinated prevention and education efforts that go across the state, as well as our quit line and all the cessation services that are provided through healthcare systems and tobacco treatment specialists and the like. Our program used to be fully funded. It was the only one in the nation that had fully funded levels for a brief period of time due to a ballot measure that had passed, putting that in place. Once the sunset happened, a ballot measure can't be changed for 7 years after it's passed by the people of North Dakota. Once that 7 years passed, our legislature did change the language written around that and kind of did away with a lot of what that ballot measure had put in place. And so now our program is no longer fully funded. That being said, we still rank quite high in terms of how other programs are funded across our country. We rank at, I believe, number 5 in the nation for monies put toward this type of programming, which is good. That being said, it's around 60% of what it used to be. And so a piece of TFND's priority for the upcoming session again is to make sure that we hold even at a bare minimum, and then that we advocate for funding to be restored. And that was one of our glimmers of success this last go around. After 2 sessions of drastic cuts to the funding, we did basically have a hold even year with the program, not just making it through, but having no additional funding cut out of it. So that is a good thing. And then the third leg of the stool is high tobacco taxes, or we typically refer to it as increasing the price of tobacco products. And that is where we really are stuck in the 90s. Our tobacco tax rates in North Dakota haven't been raised in quite some time. And there is evidence-based data showing that big jumps in tobacco price, in particular, if it's $1 or more at one time, has some identifiable or quantifiable health-related benefits to it. And so for every $1 increase that happens all at once, there is a percentage of reduction in use rates. It's around 10% reduction in use rates that do occur from people being incentivized to quit and looking for quit services, for youth being priced out of the market or not being willing to shell out the money to try something that is cost prohibited with their limited disposable incomes and such. And so TFND does always advocate and educate around increasing the price of tobacco, and we'll get into that more in a minute. Other tobacco-free policies that we typically look at and educate around are Tobacco 21, and this was another kind of bright spot for us. We've talked about this for a long time, and many of you locally had done some work across the state on Tobacco 21 education, including passing some local ordinances that adopted this, and it made it easy for it to get ratified at the state level, especially after President Trump made it a federal policy at the end of 2019. And so in our 2021 session, North Dakota did pass a Tobacco 21 bill that basically adopted or ratified the federal Tobacco 2021 language. And so that is considered a pretty great win. in terms of a tobacco-free policy, because it puts on our books something that's not easily changed, so to speak. So if our federal law were to go away or be edited in any fashion, if North Dakota law is stronger than what the federal law is proposing, it would supersede federal law, which is great. And so just having gotten that on the books was really important. And we recommend that you all continue to work locally to put those on your local books as well, because local law would perform in the same way if something were to happen to our state, federal and state tobacco 21 laws. Your local ordinances could save the day if you have that on the books for your communities. Tobacco-free parks, tobacco-free schools, tobacco-free grounds, tobacco-free events, fairs, whatnot. Those are all ways that we continue to try to denormalize tobacco use being out in the community, especially in areas where young people congregate, because it gives I think less credence to tobacco or vaping or cigarettes being something that they should be used to seeing or looking to try. And so while we don't typically attempt to write laws at a statewide level in those things, we do hope to help continue supporting you in your communities as you put in local ordinances or school policies or things like I know the North Dakota State Fair has attempted to do like a tobacco-free day or a tobacco-free venue. And we appreciate that because, again, it helps keep at the forefront the dangers of secondhand smoke, the dangers of having tobacco normalized in front of our young people. And so if there are ways that Tobacco Free North Dakota can help support you in those efforts, be sure to let us know. And part of doing that local work, I think, is so valuable because as we work on state-wide policy, if we're able to reference back and point out local policy or local ordinance that's working and that has been adopted in multiple places across the state, it helps us better make the case that this is something that all North Dakotans should have and all North Dakotans should benefit from. And that's very similar to how the indoor smoke-free air law came into being and became such a strong piece of policy, is because by the time it was finally fully finished and passed in 2012, almost 70% of North Dakotans were already covered by local smoke-free policy, local indoor smoke-free air policy. And so it made the statewide case easier to make. And so that's why we typically talk about these. Other policies that aren't listed here that have cropped up just in very recent time that we at Tobacco Free North Dakota are keeping kind of a pulse on or kind of dipping our toes in the water on would be things like flavor restrictions for flavored tobacco products, labeling requirements, in particular for e-liquids and ENDS products, the ENDS classification, which is classifying electronic tobacco products as tobacco products, because in our view, tobacco is tobacco is tobacco. And so we want to call it that and see it regulated and licensed and monitored the same way other tobacco products are in our state. And so those are all other policy priorities that we'll talk about a little bit more at the end here. Quick facts on our taxes, just because that's such a glaringly missing leg of our stool. It hasn't been raised since 1993, in fact, and the cigarette tax stands at 44 cents per pack. That puts us at 49th in the nation. Back in 1993, when that was passed or put in place at the 44 cents, we were number 8. So you can see just how far we have fallen from the top 10 all the way down to the very, very bottom. Our federal taxes stand at $1.01 per pack, and that was enacted in 2009, the last time that was increased. And you can see that like pipe tobacco, cigars, those are a different taxation method at 28% of the wholesale purchase price. This is actually where we advocate for the electronic products to fall as a percentage of wholesale. And then chewing tobacco or snuff or loose tobacco are on a per weight basis at 60 cents per ounce. So we have 3 different taxation methods on tobacco products in North Dakota. And then the electronic products or vapes, they stand at 0. They are just simply subject to a simple sales tax the way any other sales taxable product would be in North Dakota. how this compares around the nation. I already told you we are 49th in the nation, but directly related to our neighboring states, we are quite lower as well. Montana stands at $1.70, South Dakota $1.53, Minnesota $3.04, and all of this is in the, I guess, being worked on by these entities as well. Both Montana and South Dakota in the last 2 to 3 years have put forward ballot measures attempting to raise their prices. South Dakota was attempting to raise their tobacco tax by $1, and Montana was attempting a $2 increase. And they had great support getting it on their ballots. Unfortunately, when the industry sees this type of work going on, they do jump in very aggressively and outspend whatever organizations are promoting this type of work. And so both of their ballots did fail, and so they do still stand at these rates. North Dakota's ballot measure back in 2016 was subjected to this as well. We had, I believe it was just shy of $4 million spent by tobacco industry lobbyists and such, putting out information that was misleading at best, false in some cases, and it just was too much to overcome. And so our ballot measure failed by quite a lot, actually, back in 2016 when we attempted to raise our tobacco rate through that method. But it's work that we continue to put forward. Vaping taxes or electronic product taxes are something that are popping up around the country now too, as people are addressing the rise in use of these products and the harmful effects that we're starting to see. And so you can see in the blue states where policy is being put in place, this is a bit of a mixed bag, to be honest, because there are so many different taxation methods. Some are using a percentage of wholesale, some are using a percentage of retail, some are using by milliliter or liquid volume, some are going by the cartridge in the case of pod systems. And so it's a bit of a mixed bag out there in terms of rates and how large or small of an increase it really is. In North Dakota, we figured out that we would need to have to get us a substantial enough raise in cost to have at least a 30 cents per milliliter tax imposed, and that still would be, I think, on the more conservative side of things, but that would give us close to having $1 increase on a package of 4 cartridges, so to speak. And so that's not something that we would prefer. We would prefer the percentage of wholesale rate and have them kind of match what we already do for cigars and those types of products at the 28% of wholesale. You can see in Minnesota, our neighbor to the east, they have 95% of the wholesale price as their taxation rate. And so I think we can still make a good case as to why North Dakota should do something similar. So in the past 10 years, we're only one of 2 states that haven't raised our cigarette tax, just as a little tidbit of knowledge for you there. And the current average rate across the nation is $1.88, and 22 states have more than $2 per pack or higher. No one comes close to offsetting the costs attributed to smoking, though, which we estimate at being about $10.50 per pack.
Hey, Heather.
Yes.
Does TFND plan to have a bill drafted on tobacco tax for next session?
Great question, Sue. Thanks for asking. And my honest answer at this point is I don't know. We have drafted one the last 2 legislative sessions and gained very little traction or support on it. And I have a board retreat coming up February 24th where my board of directors will be discussing all of that in detail on whether we will draft our own bill a 3rd time or if we'll try and jump on and support a bill that's being drafted by another entity.
Thanks.
You bet. Okay, so looking back at 1993, this is just a fun little exercise. We can see just how much has changed or hasn't changed. My favorite one on here is that there were only 623 websites on the World Wide Web in 1993. And so the case can be made that in 30 years, so much has changed that tobacco rates should change too. And again, this is just kind of for fun. Okay, so how we work with and how we talk to decision makers. And before I get into this, I apologize, but I am going to have to pause us for just a moment. So if you need to take a quick 2-minute break or a quick check your email, we'll resume in about 2 minutes. And when I come back, before I start again, I'll answer any questions that might have come up similar to Sue's question. Otherwise, we'll continue on. So a quick 2-minute break. Okay, sorry about that. I took just 1 minute, so I'll give about 30 more seconds in case anyone else left or needs to come back. Apologies for the interruption. Okay, we will resume. Okay, so informing decision makers, this is where we'll get into a little bit more of the process and talking through that, but some of the easiest ways are to simply meet with your decision makers, to have conversations with them around why we support a policy or not. And this falls into how we can differentiate between advocacy and lobbying. For instance, if you're going to be a lobbyist in North Dakota, you do have to register with the Secretary of State's office. You do pay an annual fee to become a lobbyist, and you're assigned a number that you have to attach to all of your testimony as you give it as a lobbyist in North Dakota. And so they do this because there are rules around lobbying. For instance, there are rules around how you can ethically participate with your decision makers and legislators in particular. In fact, some ethics rules were put in place a few short years ago to help define that even further. And so you can't, be giving gifts, you can't be spending lots of money to try and influence a decision, those types of things. And in many cases, where you work and what your role is at your job might preclude you from lobbying. And how I define lobbying, and the easiest way to think about it, is that lobbying is asking for a yes or no answer on a specific piece of policy. So you're asking for a vote, or you're telling them how you want them to vote. That's considered lobbying. Advocacy is something that anyone can do and is similar to educating somebody, and it is not attached to a specific vote or bill or written policy per se. It's more about talking through and educating around an overarching policy goal, like a piece of the three-legged stool. And so anyone can advocate for, a strong indoor smoke-free air laws, but not anyone can necessarily say, please don't vote yes on the cigar bar bill in front of you today. And so that's how you can kind of think about educating and advocacy versus lobbying. And so if you work for an agency that doesn't allow you to lobby, you just simply need to be a little bit more careful in some of your education efforts, and don't ask for a specific vote, yes or no, or don't talk about a specific bill or bill number, or language piece that's in front of your city commission or whatnot, talk in more general terms about how we know these are, best practice evidence-based policies that would reduce youth rates or reduce use rates, and talk about why it'd be important to support the policy and not the vote or the bill, or so to speak. Any questions regarding the differentiation between advocacy and lobbying? Okay. So you can see here, we have some different examples of working with community members, hosting educational events, having some of our advocates testify or work alongside of us as we propose different policies. And decision makers is basically anyone in your community or in our state that has a role to play in passing policy or implementing policy that has been passed. And so state and local legislators, city commissions, park boards, school boards, county commissions, and such, and how we reach out to them needs to be a multi-pronged approach, in my opinion. And so calling them, emailing them, sitting down for one-on-one meetings or panel presentations, or helping host a Q&A forum in your community where a piece of the discussion is centered around tobacco prevention policy. All of those things can be important groundwork to lay ahead of any actual official meeting or vote that would occur. And so we have different trainings that we can help do. I know we've done them in the past with some of our national partners and benefited from some of their national perspective and grassroots organizational efforts. And we can help train you on that, or we can participate alongside you on that, providing letters of support or additional testimony that backs up your own. And so let us know if you want help doing any of that homework, if you've already got things in the works that you want any backup on. But there are some very specific relationship building presentations and policy grassroots advocacy coalition building presentations that we can help you access if you haven't had any of that so far, if you're newer. Andrew covered this super eloquently in our second session, and so if you weren't able to join him for that, it is recorded and posted on TFND's website. And so I won't go in depth into this and how we can utilize the media to help push our messages out to the masses and use it for education purposes. Just know that you can take the time and go watch Andrew's presentation, and you'll have an excellent crash course on how to work with the media and utilize them to your best advantage to do community education and outreach. Same with social media, that's covered very nicely in Andrew's presentation, so I won't belabor that, but I will make mention of it because it's kind of been a great avenue for us to be able to talk to not just our peers or community members, but our friends and family in a little bit of an easier way. Sometimes conversation over Thanksgiving dinner table isn't as easy to have as posting some educational pieces on Facebook that might catch the attention of a close friend or a family member and make a conversation starter a little bit easier. Letters to the editor are something that we've used fairly effectively in the past. In fact, we had some great ones written helping us kind of fight that cigar bar bill this last go round in particular. And so coordinating those across the state and releasing them at staggered intervals or so that they coincide in their publications can be a good strategy for not just the cigar bar bill in particular, but for any tobacco education or during Quit Week is another good time that you could have staggered letters to the editor, promoting the cessation services that you have in your community, or if we are just trying to do some blanket education on increasing the price of tobacco and why that's important. These have been utilized for many, many years to a pretty good degree of effectiveness. And so know that many newspaper institutions across the state will have some rules around how often you can do these. And so you might want to have, several volunteers in your queue, so to speak, that are willing to attach their name to different pieces, especially if you're helping write them so that the messaging is consistent. You might want to have, kind of a group of folks that take turns submitting them, because I believe it's once every 30 to 60 days. You're allowed to submit a letter to the editor and have it published, and that's a pretty liberal application of the rules that I've seen in place in some occurrences. And so they're short, concise, and a lot of times they can tell a little personal experience that make the policy or education more real to the community. And then community-wide activism is another great way. And you've seen, I think, a lot of youth projects throughout the last few years coming out of the Break Free Youth Action Summits that have been hosted by Bismarck and Fargo. Bismarck Burley Public Health and Fargo Cass Public Health host these each year. And we have our next edition coming up at the end of March. And so youth advocates have played a strong role, I think, in bringing some of this work back to their communities and back to their schools. But this is something that we can do with the general public and do on our own as well. And you've seen a little bit of that. And I know some of you have participated very strongly in helping TFND collect our individual support cards and having people sign off on requesting our policy makers and our legislators in particular to implement some of the policies that we're asking for. I know that we've had cards for individual support cards that you've helped us get filled out for increasing the price. Last session, we also had them for preserving our indoor smoke-free air law and for committing to fund the tobacco prevention and control program. And then there's a youth version out there now that kind of gives our younger people a voice, just talking about tobacco prevention policy as a whole. And so that's something that we can help do in a community as well. In terms of helping promote policy or help you put in place something that would be maybe more specific to something that you're working on. And then around the tobacco-free holidays that occur each year, we try and promote what some of our national partners are working on. Campaign for Tobacco-Free Kids in particular does some great work around the national holidays. So does Truth Initiative, so does CDC, and some of their best practice promotion. And our next one coming up is the Great American Spit Out in February. And then TFND in particular plans to have some things launching and releasing for Takedown Tobacco Day, which is April 1st this year. So it's not going to be an April Fool's when you see us, advocating for some of the tobacco prevention policy this year. It's going to be part of Takedown Tobacco Day. And it used to be called Kick Butts Day, but they changed that name a couple of years ago. All right, so that's kind of my stopping point for kind of background history, what these policies are, why we talk about some of these policies. Before I get into a little bit of background on what occurred this last legislative session and how it's going to influence what we ask for and promote for the next legislative session, are there any questions? I got my PowerPoint off my screen. I can see faces for a second. Any questions or places of discussion that we want to have before I move on to talking about actual bills and things?
There was just one question from Sue in the chat, which she did ask live, so you addressed that one. And then Chelsea made a mention in the chat that you could be a concerned citizen after work hours asking for a vote with your personal email. So just throwing that out there.
Fantastic. Thank you, Chelsea. And Chelsea is one of TFND's illustrious board members. So you can always reach out to TFND board members too with questions and things. They're super knowledgeable and super helpful. So thanks, Chelsea. All right, I'm going to continue right along in that case. We'll put this back up. So in the 2021 session, we monitored about 9 different bills, and some of you have seen this information before, but I do want to give a brief recap just for those of you that are newer. One of the main bills that we've already been talking about this morning is the so-called cigar bar bill. That was House Bill 1152. It would have carved out an exemption for cigar bars and lounges, and the language around what a lounge is, or even like what types of tobacco would be allowed, was very concerning and vague. It talked about premium tobacco products, and a lounge isn't really a thing in our century code. And so we feel that it really would have set a new precedent and opened a lot of doors for additional rollbacks and other products to be used, or other entities to request, similar types of circumstances for themselves. In our world, a correlation would be, vaping bars or hookah lounges or things like that. And initially, it had kind of a roller coaster of a ride. It initially came out of the House Industry, Business, and Labor Committee with a do not pass recommendation. That's what DNP means. But then it got re-referred back to that committee by its sponsor, where it then came out as a split vote, meaning it had no recommendation. So that tells us the sponsors and industry supporters went back to that committee and lobbied them hard enough that a couple of them changed their votes. And so that was really concerning. So that when it got to the House floor with no recommendation, it really kind of was a wild card free for all, and it ended up passing out of the House by just 3 votes, 48 to 45. And there were a couple of people missing that day. Whether that would have helped or hurt us, we can't say, but it passed with 3 votes cushion and went over to the Senate. It came out of the Senate Industry, Business, and Labor Committee with no recommendation. It's a 6-person committee, so the vote was 3-3, which is actually similar to what it had done in the 2019 session. And then it ultimately failed on the Senate floor, like I said, by just 1 vote. 23 to 24. You can't really cut it any closer than that. So again, I feel like we're going to be seeing this come back. And again, a huge piece of what we'll be working on this spring, summer, and fall leading up to 2023 will be talking about how to educate and advocate against any efforts related to passing the cigar bar bill again. House Bills 1403 and 1422 were our tax efforts this year. So these 1403 was the bill that TFND helped author and get sponsored and submitted. And our sponsors were Representative Mitzcog and Senators Beckedahl and Senator Oban. And it would have raised the cigarette tax by $1, quite simply. And it came out of the House Finance and Tax Committee, which you can see it's our worst committee. It's our most difficult, toughest committee, and we're in front of it all the time. And it came out with a 9-4 do not pass recommendation. And so it failed fairly miserably on the House floor, 25 to 66. 1422 was an interesting bill. Another of our strong allies, Representative John Nelson, submitted a bill alongside ours and hoping that he could gain some additional traction, and that if we're talking about a couple of different bills, maybe one of them would get through or have a better chance. And so his bill not only did what ours did by raising the cigarette tax by $1, it also raised proportionately all the other taxes on all the other tobacco products. So it would have increased the percentage of wholesale rate on those products, and it would have increased the weight-based tax rate as well. That one really didn't do any better. Ultimately, it still came out of the House Finance and Tax with a 9-5 do not pass, and it failed just slightly less miserably on the House floor. And this is an argument I think that we have to work on making with some of our legislators that we have personal relationship with, and explaining why this type of policy is so important and what it could do for our state in terms of providing funding to offset some of the costs. Senator Nelson in particular tried to make that case, and that some of this funding could be utilized, for Medicaid expansion and some of the other really great health policy that needs funding in North Dakota. And unfortunately, it fell on too many deaf ears. And so maybe that's an avenue that we can take when we're talking about this. TFND itself does not ever allocate the money in our bills. We prefer to let the legislators do that as part of their job and what we elect them to do. And that seems to give us a little bit more validity than trying to say where we want the money to go, other than that we know we want it to go to health related programs and services. Just a little side tidbit there for you. Senate bills, here's where we had 2 of our successes that we already kind of talked about. The Department of Health budget, or the Tobacco Prevention and Control Program budget, passed in Senate Bill 2004 with a hold even level for the year. That was great. In 2017, it took a 40% cut. And then again in 2019, it took additional, I think it was a 15% cut that year. So after losing so much funding 2 sessions in a row, it was nice to see that not happen again. And then Senate Bill 2156 was the age 21 ratification bill. And so that was great as well. Something to watch for that we are.
Can I Jump in on that T21 bill for
Yes.
just a quick second. Neil and I were doing some looking into that recently, and I just wanted to highlight, we did find a passage in there. It is Century Code 12-1-31-03, and then at the bottom of that is subsections 1 and 2. And this does not apply to an individual under 21 years of age who possesses cigarettes, cigarette papers, cigars, snuff, tobacco, and other forms, essentially when in the performance of the individual's duties as an employee. So I know this has been an issue that people have talked about a lot in terms of the age of an employee for selling tobacco. They did clarify that in this, that age 21 does not apply to that clerk. So just to throw that in there, because I know that is a common question.
Thanks for bringing that up, Abby. I really appreciate it. Yeah, so obviously you can't purchase those products if you're younger than 21, but if you're working in a convenience store and you're 19 or 20, you can handle them behind the counter and sell them. That's a great clarification to have. Thank you for bringing that up. So any other questions or commentary before I continue on?
Preston had asked in the chat about the number of cities having the smoke-free law and local ordinance. I have 11 cities reporting that ordinance locally. And then also, would that cover compliance checks? No, Preston, those were just smoke-free law adoptions. So I don't have specific on who has compliance checks. Does that make sense? Or if you have more questions, you can let me know.
Good questions. And I think that brings up a good point that we were already kind of talking about a little bit earlier, in that local ordinance can play such a key. We were talking about how many of you had those local ordinances on the books prior to T21, and then of course prior to the indoor smoke-free air law passage. And I think it's not too late to continue to put those ordinances on your books, especially in the case of the indoor smoke-free air law, since we know that that's going to come under attack again. So in this interim time period, if you want to work with your city councils or county commissions or local entities to still adopt an indoor smoke-free air law ordinance, even though we have it at the state level, just simply ratifying or adopting the state's language would go a very long way to precluding cigar bars to being able to come into your community. And so the communities, those 11 communities that have local ordinances on the books, already have an extra layer of protection against cigar bar potentially getting passed as a state piece of policy. And so if that's something you want to work on in the interim, TFND is happy to support education around that or testimony for that in front of your local decision makers.
There's also one more question in here. Nancy said it was announced yesterday that Rick Becker will not be seeking re-election and is done in December. What impact might this have on the cigar bar bill efforts?
Well, he was not listed as one of the main sponsors this last go round. Dan Ruby was kind of leading the charge on the House side, and Ole Larson was leading it on the Senate side. We know that Becker was a supporter, Representative Becker was a supporter. That being said, yeah, that's kind of a wild card. Very interesting to see him not pursue. It's going to be, and we can talk a little bit about this if we want to pause the presentation for a minute here. I'm going to just come off of my share screen so I can see faces for a minute. And since some of you have had this information already, it's going to be kind of an interesting session coming up. There is a ton of change coming and a ton of turnover already happening. I had not even seen Representative Becker's announcement yet, so you guys just broke that news to me. But there is several other major shakeups that have also kind of come into play. Senators Wardner and Heckeman are not going to seek re-election. Neither are Senators Nicole Pullman or Senator Aaron Oban. On the House side, our majority leader, Representative Pollard, has opted not to seek re-election either. I mean, so there's going to be some crazy, crazy developments, I think, as we see the 2022 election results in particular, and then just see who decides to step up and fill some of these vacancies being left open by some people that have really served a very long time in our legislature. And so far, it's been a bit of a mixed bag on some of our opponents and some of our allies being the ones to leave the legislature. So it's hard to predict what that will mean for us. In general, we've made a lot of ground in the last couple of sessions with having our policy and our bills supported by bipartisan sponsors. We've really done a good job, I think, of getting across both sides of the aisle and having Democrats and Republicans on our bills as sponsors and as our advocates in testimony and on committees. And some of those folks are leaving. And now some of our opponents are leaving. And so I think this gives us some prime opportunity to hit the reset button. And if we can work really hard to get in front of all of these new people as they are oriented into their first legislative year, and explain to them the importance behind the tobacco prevention policies that we're attempting to promote, and the value not just in funding that like a price increase would create, but the money saved and the cost saved by just having less people in our state using tobacco products could be hugely beneficial. And so in 2022, for that election, all of the odd numbered districts are up for re-election. And so if you have an odd numbered district in your area, whoever holds those seats will have to be either re-elected or newly elected. And then because of the redistricting that just happened, because of the 2020 census results, there are an additional number of seats that have come into play because of how the boundary lines were drawn. And I'll show you those boundaries in just a moment. When I screen share again, I can pull some of that up as part of what we walk through on the website. But that's why some of the retirements are happening that we're seeing, is because people have lost their district, so to speak. Their boundary has changed. And so now they have to either attempt to be elected in a different district than what they had before, or I guess in some cases, if you got your boundary line out of where you live, then you might have to move if you want to stay in your same district, if you don't want to run for the new district. So anyway, there are going to be more seats up for re-election than typically would be, just because of how that redistricting played out. Does that make sense? Are there any further questions around that? Thanks for bringing that up, Nancy. I appreciate that a lot.
Heather, do you know how many new districts were created?
Let me go ahead and share screen, and we'll pull that up right now and take a look at it. We'll diverge a little bit from the PowerPoint. We don't need to stick with that per se. All right, get this up here. Can everybody see my screen?
We are seeing your email.
Excellent. Let's get to where I need to be here. Okay, so here is the new map for 2023 to 2032. And I know it's a little bit difficult to see, and I can zoom in a little bit, but a couple of interesting things to note because of how things shook out. There are some, of course, boundary changes, and in the bigger cities, we'd have to zoom in quite a bit because you all have multiple districts. But for those of you that were familiar with your boundary changes in the first place, you could maybe spot some new things. And then there were a couple of districts that got split for the very first time. So now over here, you see a 4A and a 4B, and up in this area, you see a 9A and a 9B. And to my understanding, what they've done there is they split how the House seat allocations will be elected. And so there's still just one senator for the district. So one senator for District 4 and one senator for District 9. But now the two representatives will have to come from the two separate areas. And so they couldn't be next door neighbors, so to speak, unless they're across the boundary line somehow. So you'd have one representative coming out of 4A and one representative coming out of 4B, to hopefully, I think their thought process behind that is to give better representation to specific or to like more covered areas across the state, so that you don't have people, in the same tiny little corner representing such a big district area, if that makes sense. And so that's a new thing that they haven't historically done, to my knowledge, that could play a role into how some of those seats that were up for re-election come into play, or how someone might be retiring versus trying to be reelected when they no longer live in the section that they would be representing. More questions around the districts or redistricting? I'm not.
Heather, this is Haley. I was just wondering if that, just on first thought, impacts any thought process on whether you would want a bill starting in the House or the Senate?
Well, historically, the Senate has been the more friendly body to us in our policy proposals. And so we typically have had better luck getting sponsors on the Senate side. That being said, we did start a couple of our bills on the House side in recent history. For the most part, a price increase bill, it's not going to matter what side it starts on, because the House Finance and Tax Committee is where it will die. No matter what, if it's going to die. That's the committee to really try and get it through, and whether we want to start there or end there won't necessarily make a huge amount of difference. For some of the other policy work, though, I think it is worth looking at who is agreeing to sponsor, and just how strongly they're willing to advocate, or how eloquently they're able to advocate on our behalf. And so that can play a message. I know I'm not giving really a hard and fast answer, or a yes or no answer, and I apologize for that, but there really are a lot of variables to consider where you would start a bill. And some of it can boil down into the minutia of just, how many bills are you helping promote and try and get sponsored? Do you split them? Do you put them all on one side? Do you try and keep multiple balls rolling in the air all at once and hope that one thing can get through in the end? And that's kind of been our tactic this last time around, with having some on each side to see what we might have an easier time getting to move forward a bit further. But to be brutally honest, what we ask for is very hard to get a lot of traction on. And so whether it starts on the Senate side or the House side doesn't play probably as huge of a factor as maybe it could if we had different policy that we were promoting. We're lucky in that we have allies in both chambers. And so that does give us, maybe on the silver lining or bright side of thing, that does give us the option to choose. Whereas if we didn't have any allies in one chamber or the other, then we'd kind of be locked in on where we had to start our bills. But we're lucky enough and have worked long enough with all of you to build many relationships that we do have a choice, and we can sometimes strategically think about how we might go about it. Good question. Other questions like that? Or while we're on the website here, I'm just going to pull up a few other things of interest. Here is the schedule for 2023. You can see organizational session starts December 5th. And so leading up into that, our kind of big months of opportunity and big months of coalition and grassroots building work will start, in midsummer and go all the way up until December. And so if you're looking at, creating a timeline or, planning out your program of work for the year, starting, as early as the spring, and then, increasing into the summer and fall, looking at the amount of activity that you might want to do to support any efforts. We, of course, rely on you guys as being kind of our boots on the ground and helping us, facilitate relationship building in your communities and working alongside you, because you guys are the ones that have the pulse on some of your decision makers and legislators and other advocates and allies that we would have, or organizations that would want to, sign on and work alongside us. And you've been key to helping us get those resolutions of support signed by many entities across the state, and that's hugely important. So if you're trying to map out some of that work for the year, know that it all kind of culminates right around Thanksgiving time as we head into December, and then the start of session is January 3rd this go around. And so it'll be fast and furious that month of January and into early February as everything gets heard for the first time. You can see all the different deadlines and what we have to follow for getting our bills introduced and sponsored. And sometimes to answer, to echo back to Haley's question on where you start something, sometimes it's simply because you can't get sponsors until the last minute sometimes. And so the House side gets cut off sooner than the Senate side when it comes to introducing bills and how many bills they can introduce after a certain point in time. And so sometimes that can play a factor into where you put a bill as well. Sometimes you just end up in the Senate because you have more time to get it done. And then crossover, meaning the deadline for everything to be heard on one side before moving to the other chamber is February 24th for the next session. And so then, if anything that hasn't been defeated in committee or on a floor vote will then go on to be heard. And so really up until February 24th is very fast and furious. And then after that, as things kind of fail or don't make it through, it eases up a little bit. Typically, our bills have stayed alive in the past until typically around, mid-March to the end of March. Unless you're trying to pull off something crazy, you typically don't see our bills making it into the very tail end of session and living on until April. They usually deal with our stuff pretty quickly. And this can be found on the state website. Once you go under here, I'm going to actually show you how to get into where I kind of live all the time during session. So if you just simply type in nd.gov, this is the home screen that it takes you to. And the easiest way I have found to get where I need to go is to go over to the search bar here and type in legislative and hit a search. And then it always brings us right up to the legislative branch. And I'm sure there's other ways to click through and get here, but for me, that's always been the fastest and easiest to get to where I want to be. And this is where you can then go into, so last session was the 67th Assembly, next session is the 68th. So if you want to look up anything that occurred the last go round, you'd simply click on 67th Legislative Assembly for the 2021 session, and then you have everything kind of at your fingertips. And you can choose regular or interim. We don't have a bill alive in the interim this time around. If you recall, in 2019, one of our bills did get turned into a study, and we had a study around the electronic vaping products and methods of taxation. And so we did testify during the interim. We did attend several committee hearings as they worked through that study. This go round, we did have one of our bills, again, get kind of hog-housed and turned into a study, but the interim committee did not take it up. And so it died for lack of being chosen to be worked on. And it was very similar to what would have been worked on last go round. And it actually was problematic in that the industry representatives or industry lobbyists had concocted the language that was the study language this time. And so we didn't really want to see it go through per se anyway. So it was fine that it didn't get chosen, in my opinion. So we can look in the interim, you can click on that and you can see what's going on, but we don't have anything being worked on during this interim, but this is where you would go if we did. So going back to the regular session area, that was what occurred, and you can see it convened January 5th last go around, it adjourned April 29th. And everything you want to find in terms of who sat on what committee, what district they represented, all the different bills that were considered and their outcomes, they're all through links here. And so, for instance, if we want to pull up House bills, they're all here in numerical order, so it's quite a lot to look through. So the easiest method I have found to get to where you need to go again is to simply utilize these search bars and type in a bill number. So if we want to go see what happened with 1152, which was that cigar bar bill that we talked about, now you can go in and you can look at the bill itself and what the language was. You can look at all the different actions that were taken around it. So it was first introduced on January 8th of that session. And then you can see where we had our committee hearings where we were able to give testimony. You can look at the House Journal. That's what these things are. So it will give you a breakdown of what happened kind of in the minutes, so to speak, and what the vote tallies were and that type of thing. Or you can go into video, which is great. This is something that was added, and now you can watch the video of the committee hearings and everything that happened and who testified and the discussion that the committee had. I think this is something that is supremely valuable sometimes, because you can see where the pushback comes, you can see how they're working out their reasoning, you can see where our opposition comes from a lot of the time. And then this is another hugely valuable section in that we can see all the testimony and who submitted what and when they submitted it. And this was, I think, one of our shining moments as a coalition, in that we had, I think, for one of the hearings, 22 different pieces of testimony submitted against, and for another, for the other side, I think very similar in number. But you can just see how our grassroots efforts really paid off, and many of you took the time to participate virtually and then also to participate in writing. And that was hugely important for us to be able to point to and say, look at all the different entities that are opposed to this. And so this is something that you can go look up for any bill. And I think another neat way to do that is by using the legislative bill tracking system. So if we go back into, I apologize, I'm clicking around here. I'll show you how to get to where I have pulled up. So if you go all the way back to, this is the legislative regular session assembly page, and you look on session information over here, there's a spot where you can click on legislative bill tracking system, and that's what pulls up this page. And if you've already got an ND login ID, this is where you'll use it. If you don't have one, you can sign up, or you can, if you're a state agency, you've already got access in a different fashion. So I won't go through that because I already logged in advance so I could show you this. But this is what it looks like once you've gotten signed up for it. And you can choose, you can cherry pick what you want to monitor or track. And so here's what it looks like when you come in. And I have chosen 10 different bills for us to kind of monitor and watch and follow. And then once you have your 10 bills kind of highlighted or check marked, to look at them again, you would just view your tracking list, and then it pulls up just the bills that you want to see, instead of having to dig through all the bills that are in totality. And then you can see where they're at, how they're doing, what actions have been taken, what votes have been taken. And it really just helps you kind of keep organized and following just the pieces that you want to follow. And you can create multiple lists if you have multiple things to watch. I know some of you wear many hats and don't just work on tobacco prevention policy. Some of you work on other health-related topics, or other organizations that you partner with have a need for you to participate. And so you can create multiple lists so that you can look at your lists by topic or by priority, however you want to do that. But I thought that this was another really cool thing that kind of came out of them having to update how we participate virtually and how that all works. And then again, testimony, if you wanted to look at or view anything. For instance, here's a piece of my testimony that was submitted the first go round, and it was a handout that I used in conjunction with my written testimony, and all of that is able to be uploaded. You can upload many pieces to help make your case. And so I think that for those of you that want, here's a resolution, our resolution of support that many of you helped us work on, and we were able to list out all the different people that participated with us that way and signed on to this. So yeah, so that's kind of my tangent deviation from the PowerPoint based on your questions. Are there more discussion points that you want to do like that, or more questions you want to ask like that before we scoot back and finish talking about the last couple of slides?
Hearing nothing on that topic, there is a question in the chat from Bev. Is there any policy that would be top priority or concentrate efforts on the tax versus smoke-free law versus flavor ban? I don't know if you're getting to that, but I don't want to detract. Yeah. There's other questions on this topic, but just to throw that one in there.
You're good. And yeah, and so to kind of recap, I mean, we've talked a lot about the three-legged stool of tobacco prevention policy. I can tell you fairly confidently that my board of directors has historically focused on the three-legged stool, and I have recommended to them that we focus on the three-legged stool. So for sure, you will see us highly prioritizing preserving our indoor smoke-free air law. As I said, I do expect that to come under attack again. I would be very surprised if we didn't see at least one bill for cigar bars or potentially something else. And so that'll be a huge piece of our legislative work for 2023. And you'll see us working more on that this spring, summer, and then heading into the anniversary of it. The anniversary of it being enacted is December 6th. And so it's a kind of a perfect timing moment heading into organizational session for us to be talking about that. And so if you are willing to participate alongside us on that, we'd be very appreciative. But yeah, so that leg of the stool, definitely a high priority. Increasing the price of tobacco, whether or not we draft another bill and really push it hard again ourselves, will be debated by my board of directors next month. But we will always educate and advocate for it. And whether we have our own bill that TFND helps author, or we support one that comes from maybe one of our national partners or from another entity, that will be a piece of our priorities. And so you will see us talking about tax increase. It'll just be in terms of what method we go about it. And then I feel like a higher priority this go round needs to be program funding, which is that third leg. We did some good work on keeping it kind of a hold even this last go round, but I would like us to see us begin to asking for some reinstatement of funds. And I think we can make that case coming out of the pandemic and seeing the rise in, the youth epidemic for the vaping products, the Valley cases that were kind of just being tracked at the beginning of the last session's go around, and then knowing that COVID has really affected lung health in our country in general. I think we can make the case that we have to be proactive with how we're offering up cessation services and advocating and promoting prevention policy. Alongside those things, this is where the big debate will probably happen with my board of directors, and some recommendations I would make for them to consider at our retreat next month would be looking at the flavor restriction policies that have been popping up and that many of you have been working on, and how we can best support that, and how that could potentially be drafted into statewide language. Looking at labeling requirements. This was something that was proposed back in 2019. There were actually 2 bills around ENDS product and e-liquid labeling. And so I could see that being something for us to consider. A bigger priority would be one of the bills that we promoted last time with the ENDS classification and licensing. Not having electronic products called tobacco is very problematic in our state because they don't require a tobacco license to be sold. They don't require any reporting to our government agencies other than what any other business would report in terms of sales tax. They don't require any additional, monitoring or compliance checks or things like that because they're not listed as a tobacco product. So unless you all have a local ordinance doing some of those things, it's not being done. And so then it's not being done the same across the state. It's kind of a patchwork of policy again, similar to what local ordinance had accomplished prior to the statewide indoor smoke-free air law. And so ENDS classification and licensing, I will be recommending to my board of directors as a very high priority for us. And so those are kind of the 3 promising practice pieces of policy that we'll for sure look at alongside of our 3-legged stool pieces of policy. That all being said, part of what is valuable to me and to my board is to hear from you guys. So if you have a local piece of policy that is working really well in your community that might easily be adapted or adopted across the state, I'd love to hear about that. If you have maybe been privy to work in other areas of our region or other areas around the country that you think, hey, we haven't really talked about this, maybe we should take a look at it. I'd be open to hearing, what another entity or area has worked on in terms of promising practice policy. So if you have something you want to shout out on this webinar, great. If not, you can feel free to call me or email me separately. Ahead of February 24th would be most helpful because that's when I'll be taking all of these things in front of my board of directors. But even after that is okay too. We'll be working on crafting our policy language and bill drafts and working on what we hope to get sponsored all the way through this summer.
Sharon asked a question, when will the new resolution of support for the smoke-free law be available?
Typically, we finish those up in the spring. And so coming off of that board retreat, that's where my board typically would adopt it or ratify it for the year, make any changes that would be relevant, and then, you know, slap our new date and signature on it again. And then we would kick that out to you following that. So I would anticipate by mid to late March or early April.
And then Sue asked a question on the merger of DOH and DHS. I'm not sure what you're really asking with that. Tobacco settlement funding really, I mean, wasn't contingent on the merger or separation of those two, so I'm not sure how that would impact that. So if you have anything more on that to clarify, Sue, I'm not sure how to answer that. And then Jordan asked if groups have previously signed resolutions of support, will they need to sign new ones?
If the language changes at all, if my board tinkers with any of the language, then we would kick that out for a new signature because we would never want to presume or be assumptive that you would approve any changes without asking. But if nothing at all changes, it's possible that we could simply reuse the previously signed resolution.
So my question that I was asking is due to the merger between the Department of Health and Department of Human Services, does that have any effect on the tobacco settlement dollars? Will that have an impact on our funding for the next year?
Abby, I would kick that question to you, or if we need to do follow-up with someone else. I would not be privy to that information, Sue, as I'm a grantee of the program myself.
I mean, in terms of the budget and the funding going forward, that is to be determined and to work on with the merged leadership. So I don't know that I can necessarily answer that at this time, how that will go forward.
What I will say could maybe be something important to do over the spring, summer, and fall, and something that we've helped put together in the past that I would love to work on with you all again, is to put together another kind of conglomeration of data and stories from each of the local public health units and grantee partners to kind of share our successes with the legislature. I utilize the synthesis report that PDA puts out extensively during session because of the great data that is, you know, collected and disseminated through it. But in the past, we've also had kind of single page sheets for each of you where we highlight some of your community work and community success stories. And so Andrew and I can work to put together something similar to that again, because when we go in front of the budgetary committees and ask for program funding, it's really important for us to be able to show our value and tell our stories, and being able to do that in a neatly organized way is sometimes really helpful. And so if you're willing to work with us on that again, like you have in the past, that could be one way to kind of justify or show the need for our funding to stay in place and to potentially be reinstated.
Heather, do you have thoughts with the potential changes, since there are quite a few legislative districts that could change on either how to build new relationships, at what point in time should they start building those relationships during the campaign, waiting till after the campaign? Any thoughts on those powerful partnership trainings and some other, what I want to say, power mapping strategies that could benefit you going into session, since there is such a short turnaround with that?
Yeah, that's a great question. Thank you, Abby. I do think, I'm going to stop sharing screen here so I can see faces, just because talking to the testimony screen isn't very fun. I do think if you happen to know who will be running to fill those seats. I mean, the time is now to start building relationship. I mean, we don't only want to be contacting our legislators when we have an ask. I think it's important that we do that, but it's also important that we just get to know them on a more personal level. And because we live and work alongside our representatives and senators in many cases, they go to the same community organizations, restaurants, churches. It gives us access that some of the huge, metropolitan cities across our country don't have. And so now would be the time if you know somebody that's considering that seat. I know some announcements have been made in Bismarck in particular. So for instance, for District 35, Sean Cleary has announced his candidacy already for District 7. Retha Mattern has announced her candidacy already. So if you happen to know those people or know of them or have an in some form or fashion, it doesn't hurt to reach out and introduce yourself. And, it can be something as simple of, hi, I noticed that you're going to be running for election in my district or in my city or in my community. And I just wanted to let you know that if you have any questions around public health policy or tobacco prevention policy in particular, I can be an educated resource for you. I can provide you any materials you might need to get caught up on that particular piece of knowledge so that you can make informed decisions if you're elected to the seat in our district. And I think doing that preemptively or ahead of elections can be hugely valuable, because then they do look to you as an expert in that field. They do look to you as a resource in their community. And when questions come up or when bills come in front of them, they'll remember you, hopefully, or it will make it easier for you to reach out to them again and say, hey, remember when we had that discussion back in May or June or July? Here's some follow-up information, or here's a bill that's coming in front of you that I think could be valuable to know this about. And it just makes that a little bit easier. So the more touch points we can have throughout the next 8 months or so, the easier it will be come January next year. Great question. And what Abby's referencing in terms of power mapping or building powerful relationships, those are past trainings that were put on at Department of Health quarterly grantee meetings. One was provided by the American Heart Association, and another was provided by the American Cancer Society Cancer Action Network. And so if you want those materials, or if you'd like to see similar training to that again, let us know and we can try and get you those materials, or we can try and set up a time this summer or fall to do an additional training.
Bev had asked a question on the upcoming youth summits. Would there be an opportunity for youth to sign a resolution, create a video clip voicing their concerns, or other ways to capitalize on their attendance at the summit that we could use with the legislators?
I think that's a great idea, Bev, and I can certainly bring that in front of the Youth Summit planning committee to see if that would be an appropriate thing for us to do. At a minimum, TFND could potentially supply the youth individual support cards that we have that talk around tobacco prevention policy in general. If you've ever been on our website looking at our support cards, they're color coded. So blue is tax, yellow is program funding, green is smoke-free air law, and red is our youth card. And so, yeah, I can certainly ask our planners if that would be something we could implement. The Youth Action Summit is going to be centered around flavor restriction and flavor policy. And so if we start to move forward on anything like that, there might be some good value in having the youth weigh in. I know in years past, they've done little PSA announcements. They've done some cool community projects like that. So I think that's a great question. Oh, and I see Jordan chimed in too. Thanks, Jordan. More questions, more discussion items or thoughts?
I don't have anything else in the chat, so if anybody has anything to add or wants to come off mute, please do. So I'm looking at my PowerPoint, and really we only had 2 slides that we didn't get to.
One was a recap or summary of what we had just gone through with all the bills. And so rather than pull up my PowerPoint again, I'll just tell you it says, in summary, we did not pass any new tobacco taxes or raise any of the current ones in 2021. We did not get our electronic products to require licensing, taxation, or regulation, and we did not get tobacco products limited to in-person, face-to-face sales. That was the one bill we didn't discuss before we diverted. TFND supported a bill that would have made tobacco products only available as over-the-counter or face-to-face sales. That would have limited online retailing in North Dakota for tobacco products to help curb the kind of wild, wild west of the honor system. Saying that you're 21 on a website, even if you're not, is fairly easy to do. And so we mimicked a bill that South Dakota had just passed last year to limit internet sales of tobacco products, and that did not pass. In summary, we did ratify tobacco federal age 21 law. We did defeat the threat to the indoor smoke-free air law, no cigar bars this go round, and we did get funding for the statewide comprehensive program. So we did have some great successes alongside our many challenges. And so the last piece of the puzzle was a slide talking about, well, what can you do? Well, we've already talked a lot about that throughout the morning, and it's educate, educate, educate. We just need to talk to everybody about the toll of tobacco and about the policies we know that can help. We need to be active advocates during the legislative session and participating as best we can virtually, if not in person, and utilizing all the great resources that nd.gov website provides for us now, writing letters to the editor, participating in public awareness campaigns, going to community forums or hosting them ourselves, helping develop grassroots support, and community champions and other advocates will be hugely beneficial and key. And then volunteering with other organizations that are like-minded, like American Cancer Society, Cancer Action Network, American Heart Association, American Lung Association, Campaign for Tobacco-Free Kids, Truth Initiative, those are national ones, but really utilizing some of the resources that they put out and piggybacking off of the backbone that they can sometimes provide is also another way to help us gain credence with our local officials and our legislators. And so trying to really build the many hands making of light work will be key over the next 6 to 8 months as well. I just really appreciate you all taking the time to be on this morning. I know for many of you, this is old information. This is old hat. Some of you have been doing this work alongside us since long before I have been here, and I've been here 5 years. And so I appreciate you taking the time to be a part of this type of conversation and this type of training, knowing that many of you are just as much of an expert, if not even more so than I am. But I feel like when we can kind of come together like this and help get people up to speed that maybe don't have the experience, and then have conversation and brainstorm things out in person, it's so beneficial and valuable to me personally, as well, I hope, to all of you. So just wanted to say thank you for that, because I know that many of you have had some of this information before, but I think it's awesome that you still come back to the well again and again. So just want you to know I appreciate that. I see Nancy has a question, but it's cut off for me. Here we go. That's a good idea, Nancy. That is something too for some of these ideas. I know we have our youth action summits as a way to interact with youth and to give them projects and to work alongside them. But for some of the ideas, if you have even just a handful of youth in your community, 2, 3, 4, 5 kids that want to put together a project, TFND can certainly help you with that. And that can be a community-led project that a SAD chapter works on, a church group, your LPHU alongside with some of your youth advocates. I know many of you have some pretty fantastic kids that have participated in the past. So if that's something you want to do outside of a youth summit or outside of what we are doing, we're happy to support that and help. Anything else? We have 33 minutes left, but we can certainly end early. I'm not going to keep you here just for the sake of keeping you here. Sue Kaler,
yes. You got that?
Yeah, I got the chat up now that I'm not presenting. Yes, we do have our video essay scholarship contest launching again this year. It will be coming out in, I believe it's February, according to Andrew's timeline. Andrew's been kind of making that his baby this year. And so yes, TFND will be giving away $1,000 scholarship to a North Dakota high school senior based on the video essay submissions that we receive. And the topics are still a little in flux, but we always have one that has something to do with the dangers of vaping that they can choose. And once those are released, we can share those across social media and use them in our communities too. Thanks, Andrew. He's chiming in now too. Anything else for the good of the order? Otherwise, I'll turn it back to Abby to close us out. You guys are awesome. Jordan, is it possible to get the plan for the National Takedown Tobacco, at least, blah, blah, blah. Takedown Tobacco National Day of Action plan at least a month ahead of time? Jordan, are you talking about what TFND will be doing to participate alongside of the national partners, or do you want the materials from the national partners themselves? TFND's version? Yes, we can work to get that to everybody at the beginning of March. Yes, we can do that. You're welcome. Thank you for asking.
Heather, are there quit week dates available yet also?
I haven't seen those. I don't know if they've been chosen. It typically occurs around that second week of June, though. That's what we've done the last 2 years in a row. So I would anticipate that it would probably fall similarly in that June 10th, 11th, 12th, 13th, 14th for a start date. And then it wraps up, you know, a week to 8 days later.
Thank you.
You bet. Abby, correct me if I'm wrong, but I would assume we'd keep the same timeline as we've done so far.
Yes, planning on the same timeline. I was just trying to see if we had an official date, and I don't know that I have one. I will have to double check. And if I do have a save the date, we'll get that sent out. But same time frame.
And then along those same lines, if you want to mark your calendars, it's typically November 29th, 30th, December 1st, somewhere in there, where we start our celebration of the anniversary of the indoor smoke-free air law and do indoor smoke-free air law messaging through December 7th or 8th. You'll see TFND promote a lot of resources from that again too. Chelsea's asking, are the new elections in June or November for the statewide legislative offices? I believe it's November. The elections in June are typically your local elections, which would be like your school board, city commission, county commission type seats. And then in November, it would be the statewide elected offices and legislative districts. Great questions today, you guys. Thanks for all the participation. All right, last call. Aurora, we have not historically put something like that together. I can talk to Andrew to see if we can get maybe a smaller pared down version ready to go on that short of a turnaround. But yeah, we haven't done anything for the Great American Spit Out in terms of a posting plan or a social media plan from TFND, but we can look at putting maybe a small thing together for you guys to have. Andrew, make a note. Other requests or things that would be helpful for you all to have that we can work on? Not that I want, to generate a bazillion more things for TFND to do, but I do like generating things for TFND to do. All right, Abby, I give it back to you. Thank you for being our host. Thank you to the Department of Health for partnering with us on this educational series. Thank you to everyone who's been on this morning. You guys have been great. And don't hesitate to reach out to myself or Andrew if you think of something after we disconnect today and you want to talk through something further, or you have a different idea or a service that we can provide. Thanks, everyone.
Thank you, Heather, and thank you all for taking time out of your day today to attend, and great discussion at the end. I did put in a plug for our next one, February 17th, same time, same Thursday of the month, and we will be sending out details on that shortly. So thank you very much and have a great day.
Thanks, everyone. Bye.